Hello, my name is Sarah Maxwell. I'm the Director of Marketing at Thrive AP. At Thrive AP, we are honored to have an expansive faculty of expert speakers and advanced practice providers with impressive credentials and experience. Today, I'm going to take a few moments to get to know one of our faculty members a little bit better and gain some of their advice for thriving in an advanced practice career. Thank you, and please welcome Ryan Nadboralski.
Thank you.
So thank you so much for joining us today. I'd love to hop right in and just tell us a bit about yourself and your practice, where you live. Let's get to know you a little better.
Sure, you bet. So I live about 20 miles south of Green Bay, Appleton, Wisconsin. Right now I work about a 50% kind of position in urgent care, doing that in a small clinic just outside of Green Bay. Prior to that, I actually worked in hospital medicine for about 12 years or so. So I have both inpatient and outpatient experience, but right now doing the urgent care and then picking up some locums positions from time to time, either in emergency department, urgent care, or in the hospital. So kind of gives me a little bit of flexibility there to do that, given my background.
That's interesting because it's one of our, not newer, but we were always family medicine for the longest time, and we knew we needed to scale and support, MPs and PAs and other practices. And you're kind of covering the gambit of all of the ones that we knew right away. We're like, we need urgent care, we need emergency medicine, we need hospital medicine. Right away, those are the ones we wanted to tackle.
Yeah, and I think we've, as far as nurse practitioners, PAs, those are probably the largest segments that NPs, PAs are working in, right? Whether that be family practice or emergency hospital medicine, more so now over the last 10 years or so, to support the physician staff. It's worked out well. My first job that I ever had was in family practice in a very rural clinic. And that rural clinic was attached to a critical access hospital. So I got to do family practice 4 days a week and then practice hospital medicine on the weekends.
Oh, that's so cool. That's such a unique dichotomy almost of getting to really see both sides of the fence and have that experience.
Absolutely.
Did that kind of select where hey, this is the path I want to take?
Yeah. So I did that for about 5 years, and then I just got more of a passion for internal and hospital medicine. So I moved into the bigger community hospitals in Appleton and Neenah, Wisconsin from there. And that's what kind of transitioned me into the hospitalist role for over 10 years.
Wow, that's awesome.
Yeah.
So what drove you then with all this experience to want to work with Thrive AP?
Yeah, so the opportunity with Thrive AP and trying to reach out to a mass number of new NPs, PAs, learning NPs, PAs is what really intrigued me about this. So, well, I could pass on some of my knowledge, not just to one student that I'm mentoring at the time, but to a whole group of students. And I think what intrigues me the most and what I found from feedback is most beneficial is getting those real world experiences. So those new practitioners can see how somebody who is more seasoned, I won't say old, but more seasoned, how they deal with some of these situations that they're coming up with on a daily basis, but really have no experience.
Right. And you mentioned mentoring, kind of that one-to-one. What do you think are some of those ideal attributes that you would find in a mentor? And maybe as one yourself, also maybe one that you experienced as you were kind of becoming more seasoned in your
career? Good question. I think number one, patience. Patience is our virtue, right? And having patience with new providers so they can make some mistakes and learn from those mistakes. Or there's not always a right and wrong in medicine either. there is maybe a best practice and a better practice, and sometimes a way in which we've been doing it for years, which isn't always the best. But just having the patience to work through why some of those things may be better in certain situations is fantastic. But I also found my students appreciate the honesty that I have in the role. Not everything is great 100% of the time, right? And there's challenges, whether that's challenges with administrative issues, trying to implement a program that would work well, but there may be roadblocks in administration and trying to sell them a certain thing. So getting students to realize that there are some issues that you're going to encounter in the role that are above and beyond medicine, that are barriers, and those barriers you need to work through. I like to be a little bit lively and interactive with my students as well, and I think getting them to think, a line that I always use is, tell me what you're thinking right now. Not giving them the answer per se, but saying, hey, you're here alone in a rural clinic. You have no other resources. What are you going to do? Let's think through it. And if the answer's wrong, that's okay. This is the time to kind of think through, make those mistakes, and then learn from them.
Absolutely. Yeah, it's that, let me understand how your brain's working and what path you're following to get to your answer. So even if it's a wrong one, I understand that, because then you can better help, right? Here's that thought process that you had. Here's that piece where just change this and you would get there, right?
Yeah. And after years of practice, I probably take certain things for granted that I think are known, but maybe they're thinking of it in a little bit different way. And that puts a light on how I should teach that a little bit better.
Right. Yeah, I forget that often too, just being, obviously in marketing, but somebody will ask me a question, and to me, it's just obvious, right? Obviously you do X, Y, Z, because I've been doing marketing for my entire career. And then I realized, no, it's not obvious to everybody. And their question actually makes me think of something else that maybe I should be doing it differently, right?
Yeah.
So it's kind of both a mentee and mentor teaching each other in some ways.
Absolutely. And I was just going to say that there's not a week that goes by where I have a student NP who I don't learn something from them. Well, they said, my clinical instructor said this, and this is it. And so let's talk about that, why that might be right, wrong, etc.
Right. We had, I spoke to a collaborating physician once who had participants in the Thrive AP program. And he had mentioned something too, similar. He was like, they actually taught me something that you guys were going over in your program that, I just hadn't heard it addressed in that way before. And that is a different way to approach the same kind of case, the same type of scenario that gets you to the same answer, but a different approach to it. And I just thought that was the most interesting thing.
Yeah, absolutely.
Well, so tell me a little bit about what is your greatest passion in your role?
Yeah, so I won't say, hey, my greatest passion is to help everybody, right? We all want to help people. But I think above and beyond that is being there for others, okay? And I think of that in a few different ways in the various roles that I've been in. When I've been in hospital medicine, I've looking people in the eye as they're going through the dying process, right? And helping them through that, but also helping family members through that. I've had comments that, I've never had that explained to me that way. Thank you. And having that said from a family member is priceless, for good or bad. And I think this is, some issues with the healthcare system in general, that a lot of time we don't have the time. There are time constraints in the clinic to talk about end-of-life issues or palliative care, that sort of thing. And so we encounter that first in the hospital, and for patient's family to explain why they're not eating at end-stage dementia, or why they can't breathe in end-stage COPD, why they're back in the hospital 6 times in the last 6 months for CHF. That's, it's certainly all important, and getting that thanks from patients and or family members is rewarding. So I think that keeps driving you too. I think there's certainly a passion I have for teaching. I've been doing that since I've been in practice after about 2 years in practice. I probably had my first student at that point. And I enjoy teaching, and I learn from my students just as much as they learned from me sometimes. So I want to help them prepare to be the best practitioners that they can.
I think I say this every single time, but every time I think what's so unique and really, beautiful about the advanced practice community is everybody is so giving of education. Everybody wants to share. It's not as much of a, no, I learned this. You go and figure it out on your own.
Yeah.
Everybody is so excited to mentor and to be a mentor and to have this amazing mentor. It's just a really cool community in that way of expertise and knowledge sharing.
I would agree completely. I think that the advanced practice providers that are out there that I have met, the vast majority of them are willing to help you. Either be a full-time mentor versus, hey, I just have a question about such and such condition. There are oftentimes in urgent care where I see an odd-looking fracture, and I just text one of the nurse practitioners from ortho who's always around and says, hey, send me a picture of that x-ray or whatever, what are you going to do? And that's fantastic. So I'm learning, and I continue to have mentors in those areas that I struggle with sometimes. Hematology, oncology.
It's a career of lifelong learning, that's for sure. It never ends. So you have to be passionate about it.
Absolutely.
So I'd love to know, we've kind of talked about your passion. What is something that is really noteworthy, an accomplishment of yours in this career you've had? It's a very impressive career. Is there something, if you had to say, hey, that's something I really like to hang my hat on, what would that be?
Yeah, about 8-10 years ago or so, I had the opportunity to present at the Society of Hospital Medicine conference. So SHM, the big national conference for hospital medicine, which was fantastic. And I did this paired up with another gentleman from the East Coast who we were presenting about the collaborative care model. And basically what that was is a model of care in the hospital where the providers, the nurses, the respiratory therapists, the pharmacists would all kind of sit down and round together. And so there wasn't a whole lot of this back and forth. But I got to present about that model, which was awesome because I was living it. We were doing something new. And it was, my first, I guess, big speaking opportunity that I had, but it was a joy to be there in front of, a large audience of people that really wanted to learn about this new system that I was actually leading. So,
yeah. It sounds,
it was fantastic.
You're creating it,
Say that again. I'm sorry.
Oh, just that you're in it, you're creating it, you're living it. And now you're kind of, it's always nice to have that moment of somebody who wants to learn from you and you're doing a really neat thing.
Yeah, and it was at a level that, it wasn't just, presenting to my hospital staff or something. It was at a level that I had never been at. So it was a good, a great experience for me, and got me involved and more comfortable with relaying some of this public speaking and what we're doing in our hospital out to the country, really. So I've had some other leadership roles. So those are, opportunities, leadership of our Code Blue committee in a rural hospital to kind of see how we're going to deal with that. I I did create a lot of order sets for hospital medicine as well, when we transitioned from paper charts to the electronic medical record on the inpatient side. So those are all great accomplishments that I think really helped everybody out.
Absolutely. And that, I mean, it goes back again to just the knowledge sharing and, hey, how can I streamline this and be more efficient for everybody? Because when y'all are more efficient in practice, it makes care more efficient. It makes patients have better. I mean, it is really full circle when you're in that space.
Absolutely.
Well, I would love to know, what is some advice that you would give, the future NPs and PAs, the ones of today and the ones that we hope can follow your career path and be just as successful as you in the future? What's some advice you would give them?
Yeah, I would say the best advice I would have is use your resources. Don't think that you know everything, and it's okay that you don't know everything. And it's even okay, patient forward facing, to say, I don't know the answer to that, but I'm going to find out for you and get back to you. So I did that a lot early in my career, and we had good mentors in our clinic, physicians I could go to and bounce ideas off of. But I think patients really respected that I don't know everything, but I'm going to find out the answer for you, and I'll get back to you, however that may be. But I think, just like in the hospital, I don't know everything about med dosing and dosing complex antibiotics or things like that. I use my pharmacy resources quite often. So use your resources out there to help you along. I would say one other thing, always keep in mind the medical legal decision-making that you're going to portray. And this is more for protection of yourself. So from a very early standpoint, my mentor had ingrained in me, don't put yourself in a box with your charting. So your charting, allow that to explain your thoughts. Don't put yourself in a box. Use your thinking of why you think this diagnosis is appropriate, but others are also possible. And that doesn't put you in a box if you ever do face some medical legal challenges down the line.
I think that's the first time I've heard that one. Yeah. That's interesting. Yeah, that's
good. All of my lectures include some medical legal charting and reminder about that, and some descriptions of what I say. I think this is an acute sinusitis because of X, Y, and Z symptoms, but I can't exclude other possibilities. So I've learned two particular mentors that I had were very stressed that quite often. And none of us, to my knowledge, have been in court.
No, that's smart. I mean, and it's unfortunate, but it's something that you really have to be smart about and think through. And, so it's good if you're giving advice and helping, the future NPs and PAs understand that, because it is something that's important to their career and important to their employers, organizations, the system. So that is really crucial.
Yeah, I think it is one of those things that is overlooked often, but shouldn't be overlooked and should be taught actually in all of the courses that you're going through. But although all of us have to go through some sort of minimal legal course that's out there, it's not based on really what you should do in practice. And your charting means everything. If you get called to a case 3 years later, you're going to have to rely on your charting.
Yeah, you have to kind of go back to that record that you have, and just, gosh, how do you remember something from 3 years ago? And especially I think in your type of practice, it's a lot of folks, especially now, and they're in quick and you got to solve it fast. So that's it's important.
Yeah, just something for everybody to think about, and I'm happy to discuss that further with anybody who has questions on what I kind of do.
Mm-hmm. Well, I know your time is super valuable, so I want to don't want to take up too much of it. So I just want to thank you so much for being here today and for sharing your expertise and your advice. We're so appreciative.
You bet. Yeah, happy to help and happy to help everybody else out there.
Thank you. And thank you everyone for joining us, and stay tuned to meet more of our faculty. Have a great day, everyone.